Last year, I felt some uneasiness in my right breast.
When I found a small lump in my left breast and it is found positive,
So immediately I came to Nagar SPARSH Hospital.
Manasi doctor gave me lot of hope, underwent surgery, and now I am free from cancer.
People should not get scared about the problem.
Hello everybody, I am Dr. Sunil Navalvan and this is Dr. Mansi. I am a surgical oncologist and she is a medical oncologist. We have two breast cancer survivors with us who we consider as role models to other patients. So we are here to share their experience. So madam, how did you come to know or how did you have the suspicion that you might have a breast lump?
That is during month of December. I had a little shooting pain in my left breast. Then I came to SPARSH Hospital, Nagar, and consulted gynecologist. And then she advised me to go for screening. In mammogram, I came to know that my left breast is detected positive for breast cancer, sir.
Madam, Nemo?
Doctors have advised that when you take bath, you have to just feel it with it. So that day, I don't know, unexpectedly, I felt there was some hardness in my right breast. So I approached her. So after that, she came to know that there is lump there. So then she advised me to Dr. Sunil Nagar. So the process started, all the tests, everything was done, and then they came to know that instead of one lump, there is one more very small one on the top of the right breast. So they didn't wanted to take any risk because of my age. So he advised me to get it removed.
So thank you so much. We have two examples of very aware ladies who were the first ones to actually pick up something abnormal in their breast through a very simple technique called as self-breast examination. Unfortunately, in India, a lot of our women are very shy to even examine their own breasts, and if they do find something, they don't come forward for checkups because of various reasons. They don't want to burden their family or they are shy to show to a doctor. But we should get over that stigma. So we would advise every woman, not only elderly women, every woman over the age of 20 years should do breast self-examination once every month, on the same day of the month, on the same day of your menstrual cycle, maybe 5 or 6 days after the menstrual cycle starts. And there are multiple YouTube videos available which you can see, and you can follow them on how to examine breast on your own. Even during bath with soapy fingers, breast self-examination does help. Most of the women pick it up during bath. We advocate every woman to examine her own breasts every single month from the age of 20 years till lifetime.
Seeing the report and other things. So you told me about the other treatments, underwent surgery. Even I was discharged on the same day. So even I felt very happy for that.
We were little aware of the problem, so mentally we were prepared for the operation. There are many tensed up for the operation, but the way you both explained, so we felt comfortable. Oh, nothing will happen. So I went through the operation, and as we told you, it was very comfortable and very easily. We were surprised that the within 1 hour we were back to the ward, and next day we had to go home. So it really, we felt it was very simple, and we have to go through all this in a easy way.
Then chemotherapy started. So even that, because of my age, one dose was divided into 3 weeks, and I was very comfortable. Little side effects were there, but I could tolerate everything.
So a lot of people, even though they palpate a small breast lump, they ignore. So what is your message for people who have a suspicion of breast cancer, and how do you advise them to go ahead?
So as I said, self-examination is the first thing. So after knowing any changes in their breast, So it is better to consult a lady doctor immediately and without hesitation. So this is not a sin or crime. They should not feel shy. So they have to consult a doctor and go to doctor immediately.
We don't feel that we have crossed that. We feel we were like we were normal before this. We are same.
Even my friends and other relatives are saying me, you are like before only, nothing to worry.
Both of them have been early breast cancer patients. So, but again, we need to know that both of them had different types of breast cancer. So, breast cancer is not one disease. Your doctor will advise a biopsy. That biopsy will tell what is the subtype, because every subtype is treated very, very differently. We have hormone positive, HER2 positive, triple negative, triple positive. We are different. We have different subtypes of breast cancer, and they are very different diseases altogether. Some subtypes you will have to take chemotherapy, targeted therapy, or immunotherapy before the surgery. So every patient is viewed very differently, a very customized, a tailorized plan is made for every patient. So please don't think all breast cancers are same. So one size does not fit all.
So we have two options when we do the surgery for breast cancer. So it might be removal of total breast, that is called a mastectomy, or only removal of the lump with margins, which is called breast conservation surgery. So both the options are equally good, and we have a discussion with the patient. We thank our survivors and we laud their effort so that they're coming forward and trying to encourage the new patients to go ahead with treatment. They have been a role model.
One small concluding line for people who do not have breast cancer: please follow screening guidelines as I mentioned earlier. Screening saves lives. It helps in early detection of breast cancer. And the early stage of breast cancers have almost 90 to 99% cure rates. So please come forward, get yourself screened.
Same way, we
Yeah,
thank you both. Really,
we
it is
thank
our.
you.
We are lucky to be under your this
Treatment.
advice and
Thank you.
treatment.
Thank you.
Thank
Thank
Yeah,
you
you.
so
thank
much.
you.
Namaskar.
Thank you, SPARSH Hospital. Thank you, all the doctors, staff, and
Yeah.
other members of this hospital and organization. Thank you. Thank you, everybody.
So thank you everybody. Thank you, Dr. Sunil. So this was our brief discussion and encouragement for all the patients who are having breast cancer. And the early stage of breast cancers have almost 90 to 99% cure rates. So please come forward, get yourself screened, and get yourself examined by oncologists. Thank you.